So that was high-skill genetics. I'm going to now go back to the ethical, legal, and social implications of genetic research and genetic screening and testing. There's so many issues that I'm just going to list them because I want to get through a lot of them, and I hope that you will think of some of these issues, talk amongst yourselves, and consider what some of these serious implications are that are arising more and more with genetic research and testing. And as I mentioned before, many of these issues are generic to other genetic disorders, so keep that in mind too. Much of what I have to say comes from a very superb 2009 article by Merchant and Robert. So first, all genetic testing of children for autism traits will require informed consent for their parents to consider. This process will be complicated because it's likely that parents will not comprehend what we're talking about when we mention genetic predispositions. So how are we ever going to really be able to inform them appropriately? 2, should parents and their children be informed of which autism predisposition alleles they carry? Such alleles may not even have been validated yet or may involve risks that cannot be reduced. Importantly, many believe that because of the lack of any benefits from such knowledge, because right now we do not have any treatment, we do not have any cures, we do not have any prevention. So the lack of any benefits from such knowledge and the existence of real potential harms and risks in terms of breaches of confidentiality, psychological stress, potential for misunderstanding, and the possible misuse of the information by third parties such as insurers or employers. So this information, many feel, should not be shared. Genetic testing should at least be required to use CLIA-approved laboratories. 4, should research reveal a genetic explanation for a child's disease, this may provide some comfort to parents who are desperate to find the cause for their child's unfortunate situation. But the parent who is found to have contributed the genetic marker to an autistic child may have ended up with painful feelings of guilt and responsibility, perhaps far greater than that it was considered when they were just considered cold and distant parents. 5, of course in bioethics there's always a competing argument, and Ken Prager and I frequently have this in our ethics committee meetings. So autonomy, as John Loike mentioned, supports sharing of information when it is desired, and some even claim that there is a moral obligation to inform. But there are difficult questions related to the future use of genetic samples and associated environmental data. And it doesn't matter whether they are identified or not, there will still be potential issues and potential harms. An important consideration in genetic research is the responsibility to family members of research subjects, who are often directly or indirectly implicated in the research and the findings. How much information do you share with relatives? And how far up the family tree do you inform? Accurate and timely diagnosis is critical for the best treatment and prognosis, and we know this, and this is one of the urgencies that parents want, to have their child tested so that they know where they can begin with right now the behavioral therapies, which is all really that we have that's legitimate to offer. But what are the risks that such testing might entail, such as changing how parents perceive the child and the child's self-image? This is important, especially when this is a very mild situation. If the child is found to be a carrier or has a risk gene but is asymptomatic, will the child be treated as if affected, creating a self-fulfilling prophecy or even a Pygmalion effect? 10, Knowledge that a child and possibly other family members carry a genetic predisposition to autism may create a whole series of stigmas and negative perceptions related to being at risk. I was glad that Rabbi Weinreb yesterday mentioned Irving Goffman in his presentation because, as Jerry mentioned, stigma is of particular interest to me. So now, how would parents starting to screen prospective mates for their children be looking at those found to be at risk? This was an important topic in yesterday's conversations. 11, research issues are raised by how testing will be conducted, by whom and of whom. What if third parties, such as school officials or a counselor, wants to conduct genetic testing as part of an evaluation of a child experiencing behavioral problems? Does a parent have to consent to such testing? 12, looking into the future, if genetic tests will become available, should they be made available and directly to consumers? Some of you may have heard already of 23andMe. And what would be the implications of testing for autism in the comfort of your bathroom or your home somewhere, but without the benefit of a genetic counselor at your side? 13, questions will be raised if there are alleles found that are suggestive genetic predispositions. Will these be used for pre-implantation genetic diagnosis, even if not definitively confirmed? Will embryos be destroyed if a carrier gene is found, as Professor Steinberg discussed? In a cost-benefit analysis, is the loss of some healthy children, you would destroy an embryo because of a false positive test, would that be outweighed by the benefit of being able to select an embryo, even if there are risks of false negatives? 14, given the preponderance of boys with autism, will there be an effort to select for girls, especially if there's already an affected sibling? And here again, I'm reminded of Rabbi Weinreb and his question of what are the needs of the unborn child. 15, genetic markers of autism predisposition may also have application in personal injury and other types of litigation. Product manufacturers or even pollutants may claim that the cause of a child's autism was genetic and not exposure to their product as the primary cause of the condition. And these cases have already been adjudicated in families who alleged that their children were genetically susceptible to mercury poisoning, and that led to the child's deterioration. To conclude, even after genetic causes are identified, additional research will be necessary to understand how the genes function, how they yield phenotypic expressions associated with ASDs, and whether ASD candidate genes act alone or in combination with other genes or environmental factors. Therefore, even after the genes associated with an ASD are identified, it is likely that reliable genetic testing remains years away. Scientists should forego the hype and think seriously about scientific advances and how to describe them. Rather, they should be in close touch with the ASD advocacy community to better inform parents about the state of the art, so that parents and the community and society as a whole will have realistic expectations and can act more effectively. There are many issues to consider, but I'm hopeful that you will consider uppermost the ethical imperative I mentioned earlier. It is not what can be done, but rather what should be done. We are entering some very, very exciting times, and I know we're going to be facing a lot of these difficult situations. Thank you.